types of walker, and what we are going to see is about, this is standard frame. Standard frame is you cannot adjust the height of the walker. If you see how much it should be, the height should be, it should be up to your greater trochanter. The handpiece should be up to your greater trochanter, and your elbow should be 5 to 10 degree of flexion. So 5 to 10 degree of flexion of your elbow, and your handpiece should be at your greater trochanter level. If you hold this way and stand, this is your iliac crest and front is your ASIS. Below that, if you see, there is a dimple, and the dimple you could see the bone, you could see this is moving. This is called greater trochanter. It should be at this level. Standing frame, it is made by your conventional method, so it was just made with a welding piece and the normal rubber ferrule. So in future, if there is any problem, you can change it, and cost wise this is very less. So the parts, if you see, this is called rubber ferrule. After you are using for a longer time, this will become goes away. So what you have to do is change the rubber ferrule once it become damaged. So this is about the basic feature of the standard walker. What is the next type of walker? This is called foldable walker or adjustable walker. Foldable is you just have to fold it. If you want to hold it, there are two pins here. This pin will be giving you stability. The usage is same like the standard frame, but only thing is you can adjust the height of the walker. You could see there are different types of holes. Depends on the height of the person, you can adjust it. So this is again standing frame with adjustable heights, and there is one more alteration here. You have to take it off like this. Once you take it off like this, what you can use is, you can use this as a reciprocal walker. What is reciprocal? You can alternatively move this. So if the person have a difficulty in propelling the walker like this, you have to use a reciprocal. Right, left, like this. How I am going to walk? If I walk this, I will use this. If I use this, I will use. So this is called opposite side we are going to move. So this is called reciprocal walker and adjustable type. Even then, if the person is having little more good balance and they are not able to push the wheelchair, then what you will do is, we will be giving this. You could see there is a wheel in the front. This you can just push. You need not to lift or things. You have to just push it and you can go. This is called rollator frame. It has a wheel. We call it as rollator frame. Again, in this you can adjust the height and you can fold it and keep it. You have to remove the thing and you can fold it and keep it. So what is the advantage when you are going with foldable types? You are going outside and other things, you can just fold it and you can use it anywhere and handy. In the standard type, this is the only disadvantage. You cannot, for portability, it won't be good. But the other way, financially it is a little more costly. And if you see any bolt, net, something was gone, you need to get it again. And same way, maintenance is changing the ferrule and other things are same like your standard type of walker. Then there is one more type of walker. In rollator frame, this type you are seeing a small wheel in it, but it has a disadvantage. If the person has a less balance, sometimes what happens, it will be slippery or it will be chance of falling because the wheel is there, they are not able to control it in a proper manner. And the other thing is, if they are using in a uneven surfaces, that is if there is a rough sand and stone is there, then this wheel won't be rolled in it. So what is the alteration for it? You have to use a same reciprocal walker, but it will have a bigger wheel. The bigger wheel can be able to roll on the sand and uneven surfaces. So you can use those type of bigger wheel rollator frame. All these three types of walker we are using are arms, that is your hand support. There are people who have very fair grip, or in case of rheumatoid arthritis, the patient will be having drift like this or small joint pain. Those patients, we have to do a different types of walker, that is called gutter walker or forearm supported walker. In gutter walker or forearm supported walker, what you are going to do is, you are going to just using your forearm. You will be holding like this. So rather than holding a walker like this, when there is a problem in the hand, you are going to use your forearm support. Then you may able to walk. Whatever you are doing, you will be doing with this. So this is called gutter walker. In gutter walker, main feature is this length and height should be normal. It should be in this way. When you are holding this height, it should be there. This length should be your gutter length, and the width should be there. Be careful enough. There will be a gutter. It shouldn't be have some pressure or compression. So you have to use some kinds of soft thing. And for remembering person, there is a complication. If you are using a prolonged type of walker, you may have a carpal tunnel syndrome because of extension pressure. What you can do is either go a soft cushion like this or do a padding. Padding with the same kind of material. You can do a padding also in normal walker. The padding has only one disadvantage. What happens sometimes if you are sweating, the water will be tug on it and become sticky and slippery. So what you can alternate do is you can use cotton cloth to wrap it and tie it so that even the sweating is there, it will get absorbed. So these are all the basic type of walker and its usages.